Welcome back to the KRUSE Elite podcast. Actually, a brand new episode style of the KRUSE Elite podcast, right, Tony?
That's right. I'm really excited about the Q&A we're going to do today. I had a little idea, though. I've started meditating again.
Mm-hmm.
I don't know if you've ever experimented that much with meditation. I got into it years ago and then basically didn't do it at all for like 5 years.
Sure.
And recently I've been doing it and really enjoying the effects of it.
That's cool.
And I was just thinking about it and I was like, there's some neuro going on here.
Yeah.
And I just thought it'd be fun to just kind of ask you about that real quick. But my theories are as follows.
Yeah.
When I'm meditating, one of the things that you do first is you close your eyes. There's a sensory deprivation there, right? You're not stimulating those parts of the brain. So I'm curious what's going on there.
Mm-hmm.
But then a lot of what you're doing, at least in the app that I'm using, is you're like scanning and noting.
Mm-hmm.
So like you might like kind of scan from head to toe and just kind of note, okay, how's my body feel? Where am I holding tension? Like, is there any pain? Am I loose? And I'm like, okay, so this is basically training interoception.
Right.
And then there's a strong breathing component. You're focusing on your breathing. You're breathing deeply in through the nose, out through the mouth, and then breathing regularly through the nose. But you're like really focusing on your breath as kind of like the focal point of much of the exercise. And so I'm like, okay, there's probably like a vagus nerve stimulus going on. You're probably activating the parasympathetic system.
Yep. You're checking the boxes.
Yeah. So I'm curious, A, is what am I missing perhaps? And then maybe if you have any other insights on what's going on there.
Yeah. Well, you really nailed the big ones. So anytime you do any sort of practice, mindfulness practice, where the goal is to bring your attention in, right? You close your eyes, you inhibit visual input. That usually makes it easier to bring your attention inward. The body scanning, again, lots of inward attention to different body areas that you normally wouldn't feel like you were focusing on, right? So all a very interoceptive based practice. And you also mentioned the breathing, and that does make it a pretty significant vagal type of activity too, right? Anytime you're focusing on breathing, because the vagus nerve is really sensitized with that, especially breathing that is more exhalation focused, I guess we might say. So breathing that happens to be more exhalation focused, meaning you are essentially drawing out the length of the exhale more than you normally would. So let's say the exhale is 2 or 3 times longer than your inhales. That is going to be more of a parasympathetic style of breathing, right? So those things you mentioned are right on. And then the one that, there's actually literature on, mindfulness practices and what areas of the brain are activated, and it's very spread out, right? There's a lot going on, but the simple explanation is what you mentioned already. And then also I would add the frontal lobe, right? Because anytime you're doing a mindfulness practice and you're bringing attention, right? Because there's that key attention and focus from the executive functions that happen at the level of the frontal lobe. It's a great deal of frontal lobe activity to bring that kind of attention to those body areas and pay attention to your breathing or, whatever it is that you're doing. So yeah, if we were to name the big ones, I would say the frontal lobe, the insular lobe, and the vagus nerve component would be a good one as well.
Yeah, that's awesome. I'm so glad you mentioned the cortex because, one of the other aspects of the practice that I'm doing is you have thoughts and they come in your head.
Right.
And the idea is you're supposed to just sort of note them and let them go and not get distracted by them, essentially.
Distracted is the key word there.
And so, yeah, there's definitely like a cortical muscle that you're sort of training there because it's so easy to just let that whole process happen.
Yes. Well, since you use the word distraction, the other part of that frontal lobe component is, remember, how the frontal lobe is very much involved in inhibition of impulsive things. So that could be impulsive movements, it could be impulsive thoughts, it could be anything like that. And so when you're doing a style of mindfulness and you're trying to kind of tone down the thoughts that might interrupt you and disrupt your focus, it's more frontal lobe activation to do that, right? Because you are inhibiting something that is more unwanted for what you're doing.
Mm-hmm. And I suspect so I often feel in my practice that I'm not very good at this.
Yeah, same here.
I still notice, daily kind of effects of like, oh, I feel a little calmer and smoother and
Yeah.
focused. So I think the act of doing it is still useful. But I read about people who are more advanced in meditation, and I think they sort of get past that cortical part where it's like that really deep meditation where like you're in that Zen state or whatever it's called, where you no longer have to fight the thoughts coming in. And fighting's probably the wrong word, but you're no longer bombarded so much by these passing thoughts.
Yeah.
And I think that's sort of like the top level of that meditative state, right? Where you're really just completely present and aware.
Right.
And so I wonder if you get to the point where that cortex is so locked in that it can kind of just...
You can probably get to that point faster too, because it is a skill development, People who are more practiced at it. It certainly takes practice to be able to do that. But yeah, they can get there faster. Things become a little bit more automatic, I guess you might say, like any skill could. It's interesting. It's not something I've played around with a lot. In fact, it's been a number of years since I explored it. Like you, I can't say I was any good at it.
Yeah.
It was interesting. I typically gravitate more towards movement than I do. I almost think about movement is like a moving meditation for me in terms of what it offers me. Yeah, I never got super interested in meditation, although I feel like I might even be saving it for a different chapter in life, if you know what I mean, because it is, I see the benefit. I did, when I played around with it years ago, I don't know, I ended up going down a rabbit hole and getting distracted like I do. And I started to also explore like binaural beats.
Yeah.
And then I ended up trying some binaural beat app and like a certain frequency, like I really enjoyed it. Like it really like, I don't know how to explain it. It took me to a different dimension, honestly. But man, it like, I was like hung over for 2 days after doing too much of these binaural beats.
Oh, wow.
It was weird. Yeah. The only thing I can compare it to that I've experienced, and it makes me think that I basically had a very strong parasympathetic shift that, I overdosed myself. I'm not saying it's supposed to be that drastic, but the only thing I can compare it to is one time I saw an acupuncturist a very long time ago. We were kind of trading skills. He was interested in what we were offering at our studio at the time when Alicia and I were doing more in-person clients at our studio. And so he was like, hey, would you be open to, trading some of, what you guys are offering and doing, teaching me some of this joint mobility stuff. And then I'll also, treat you with acupuncture. And we did that for a bit. And he overdosed the heck out of me with acupuncture once. And I think I had one of those big, like parasympathetic shifts that was essentially too much like change in my autonomics, like too aggressive. And man, same thing. I was like hung over for a couple of days. It was weird.
Oh, that's fascinating.
Yeah. So there could be dosage things there too, which is interesting. But that was about the extent of my serious mindfulness attempted practice anyway.
So using some of the models that we talked about, is that overdose phase, do you think there was like a raise of threat response to it because it was such a shift? Or
no, actually, the way I experienced it was not so much threatening in terms of like, was it decreasing my performance and increasing symptoms of any kind? I didn't experience it like that. I experienced it as almost like it was so novel and so different for my brain and body that I ended up being, I guess, a super responder, where I responded so much. It was almost like a inappropriate response in maybe the right direction, but then because it was such a shift for me, I felt it as maybe it affected my autonomics in a way that made me feel almost just like too chill for too long, if you know what I mean. And chill when I didn't want to be.
Yeah, that's
Yeah.
fascinating.
Yeah.
One of my favorite movies growing up was Office Space. Have you seen this
Yeah,
movie?
yeah.
So for the
Been a while, but
listeners,
yes.
yeah, basically this guy, he's at a job that he hates or whatever, and he goes to this hypnotherapist. And the hypnotherapist is like deep in the middle of the treatment, like, you're gonna relax, like, you're not gonna care, like, deeper and deeper. And like before he comes out of it, the guy has a heart attack, dies right there. And so he never comes out of this like hypnotic state of like being super chill.
Yeah.
And so then he goes back to work and he like doesn't care and like nothing matters and the rest of and hilarity ensues, right? But I think that was you for 2 days.
Dude, I'll tell you what, I was almost hypnotized once for real in high school.
Yeah.
But I bailed out. I did not like the feeling of it, but there was a hypnotist that came to our high school during some event. I forget what it was. And there was like 6 kids. Like, so they basically did something to, the crowd of people there. And if you wanted to participate, they took you through the cues, close your eyes, do this, do that. If you wanted to participate, you could. If you didn't, you didn't have to. And I started going through it. And I got to a point where it became very scary because I felt myself feeling like I was losing control, and I opened my eyes and bailed out. And I'll tell you what, I didn't know if I was a believer back then. I just didn't know, but I was intrigued. Man, at one point the hypnotist had, 3 students doing some funny things. It was bizarre. It was a bizarre experience.
Yeah, that's what I hear. It seems like in a group of people, there's always 1 or 2 that are susceptible, right?
Mm-hmm.
Suggestible, susceptible, super responders, whatever the word might be. Interesting. There's probably some neuro there.
Oh yeah, I don't really know what it is.
Yeah,
but it'd be interesting.
Interesting. Well, awesome. Thank you for indulging me. On that one. But yeah, meditation has been a really cool addition to my routine lately.
Yeah, you'll have to update us and see. We'll see how you're using it and enjoying it, and see if you're improving your skill set of it.
So we're gonna, like you said at the head of the episode, we're gonna do something a little different today. You guys put a post up on social media, on Instagram, I think, and then perhaps in the dojo, in the strength dojo, or
we didn't do our inner community, but we went. We did get questions from people on Instagram. So awesome. We had put out a post, and then we had a question box up as well. So yeah, the goal was to gather some of those questions and see what we could take care of here in the podcast.
Yep. I'm super excited. The questions were really great. So thank you to all of you who posted questions. And I imagine we'll be doing this again. So keep your eyes peeled for that. But yeah, to kick us off, I'm just going to start reading through them.
Yeah.
This is from Isuluju Linda. What would help to release the tension on the whole right side? One line from head to the toes.
Mm-hmm. So there's stuff to consider just from the statement, right? And the question, because sounds like this person's feeling muscular tension, or however they experience it, tension, stiffness, a line from head to toe. So basically one side of their body is too tight, let's say. Okay. So that in itself is interesting. We can theorize a little bit based on that, because that's something that I would hear somewhat commonly when taking like a health history with a client. Yeah. So the first thing, and there's several different possibilities here, but I'm going to talk mainly about the one that seems to be the most common when people are feeling all one-sided tension. And I would probably go on to ask, like, if you feel all that tension on one side of the body, do you also have some level of injury history on that side of the body? because most of the time people say yes, like, oh yeah, come to think of it, if this is the right side of my body, I've sprained my right ankle more times than I can remember. I had a MCL sprain a couple times on my knee. My hip doesn't seem to have a major problem, but it just kind of aches me from time to time. And, they basically have this injury history that they could list from head to toe. Everything kind of sounds like me actually during my athletic career, all these kind of joint issues, muscle issues on one side of the body.
I'm mostly right side, I think.
Are you? Yeah. And it's quite a common presentation. So the common thing about it is usually we would start to consider that might be what we call a PMRF history. And we talked about the PMRF in several podcast episodes. It stands for pontomedullary reticular formation, and that is the brainstem. And so when the brainstem is not doing its job appropriately or optimally, let's say, you can develop muscle tone issues on one side of the body because you have a right brainstem, you have a left brainstem, right? And so these issues can be one-sided, and they often are, right? Because as humans, we're not perfectly symmetrical. The way our neurology works is not perfectly symmetrical. Your brainstem is a subcortical region of the brain that is involved in all sorts of automatic processes. So that is calibrating muscle tone, so kind of setting global muscle tone with the help of other structures too, like the cortex and the cerebellum. But its job is to help set global muscle tone ipsilaterally. Ipsilaterally means one side of the body. And you can look even deeper in the PMRF. It's involved in autonomic function. So think like blood pressure, things like that. And it's involved in posture. Okay. And if you go even deeper and look at some of what we know about the muscles, it is responsible for inhibiting flexor muscles above the level of T6 on the spinal cord and extensor muscles below the level of T6 on the spinal cord. So these folks that often have this one-sided pain history and tension from head to toe sometimes present with what we would look at as a PMRF posture, which it can be happening on both the upper and lower part of the body. But for the upper body, it would be kind of an internally rotated shoulder that is maybe more depressed, kind of like sagging down on that side. That would indicate more of a loss of tone of the extensor musculature above T6 and maybe increased tone in the flexor compartment in the upper body. So think like the pec region, the bicep region, even down the arm, forearm flexors, hand and finger flexors. Sometimes people can have this almost claw-like appearance when they're walking with their hand. It's fairly subtle in a healthy population, but it can be there, as well as excessive pronation of the forearm. So that's kind of the upper body, and the lower body is easier to spot. It's basically your leg is turned out. So kind of the duck posture with the leg, the foot's turned out, the hips turned out, and that's an indication that there's increased extensor tone, kind of externally rotating the lower body, and perhaps a loss of flexor and adductor tone. Again, primarily at the hip. It also affects the lower leg too, but that's what you would call a PMRF posture. So perhaps this person asking the question might have some PMRF posture going on. So there's lots of possibilities for how you might approach it. I'll try to kind of provide some low-hanging fruit, some pretty reachable things. I know it's going to be we're kind of split with our audience, right? We've got people, the general population, who are fitness enthusiasts and want to know more about neurology, but they haven't taken our courses, so maybe they don't know all the lingo yet. And then we're going to have some of our students listening to this who are going to be hearing about the PMRF at a very detailed level from me all the time. So I'm kind of trying to strike a balance here in terms of how we might be able to excite both groups. But the first idea is kind of an odd one. It would be to perform complex nonlinear movements on the opposite side of your body to where you're feeling the tension. So if you're feeling the excessive tension on the right from head to toe, making your practice, your movement practice, a little bit asymmetric, not even a little bit, maybe a lot, maybe doing like 70% of your movements on the left side of your body for an amount of time, right? So this could be 4 weeks of practice, 6 weeks of practice where you're doing more with the opposite side of the body. My preference for that would be complex nonlinear styles of joint mobility, like I'm always talking about and teaching on social media, circular motions, things that require a great deal of accuracy, taking joints and muscles through their end ranges of motion, but in a more sophisticated way than just linear movement.
Yep.
And so we've got drills from head to toe that we teach people that is a great tool set for working with the PMRF. So that would be my first recommendation. And that can go a really long way for people. And it's very interesting and weird when someone learns that, let's say, the right side of my body is chronically tight. So you would assume I have to target the right side to deal with the tightness. And maybe you got to do some localized stuff there. But a lot of the time, if you go to the opposite side of the body, because when we exercise the opposite side of the body, that voluntary movement is activating the ipsilateral cerebellum. So that means same side of the body cerebellum. But it is also involving the contralateral, which means opposite side of the body, cortex, especially the frontal lobe. And the frontal lobe fires down into the brainstem. So we're back to the PMRF. And it's ipsilaterally. So if I'm moving the left side of my body and activating my right cortex as a result of that, my right cortex is going to fire down into my right PMRF and help it do its job better. Which, what does that mean? Well, it could mean better balance of muscle tone between flexor and extensors. And that's essentially what we're talking about there, is balancing muscle tone. It also could mean inhibiting some pain, because the brainstem can do that through some anti-nociceptive pathways that get activated when you start working with the brainstem. So you get the idea. You can even affect autonomic function on that side of the body. So that's the first idea. And then some other possibilities would be literally doing some exercises. Remember, we talked about the brainstem. We talked about the T6 dividing line. So extensors above T6, flexors below would need some work.
About where is T6 on the spine?
I mean, if you find your sternum, if you kind of palpate your, at your chest and work down into your sternum, think like nipple line, I guess, would be a good.
Sure.
Yeah, you could go, if you have that in mind, that's a reasonable landmark to give you, close enough. And if you do, this is where you could now think about it in a more localized approach, where you could do some specific muscle activation of extensors above T6, because remember, they might be lacking the tone. And then in the lower body, you could do more flexor and adductor work below T6. So what does that mean? It means, well, do some sort of muscle activity work, whether it's, strength training, some form of strength training, isometrics, right? And target it towards those muscles. So we're exercising your, good starting points would be exercising your mid and upper trap and like your rear deltoid area, even your lats. Okay. Your triceps, right? Even your finger extensors could possibly be useful there, but you get the idea. And then on the lower body, exercising your hip flexors, right? And your adductors, which are very commonly weak areas for a lot of people, right? So however you might approach that could be really, really valuable. And then if you combine that idea, and maybe that stuff is done more linearly, like more traditionally, like whatever you're doing for a activation for your mid and upper traps in lats, that could be linear strength training, right? But then on the opposite side of the body, you're doing the complex nonlinear stuff. It's more complex to feed this pathway that we're talking about, this loop.
Yeah.
That right there is a phenomenal starting point for postural issues and complaints of muscle tightness on one side of the body, if in fact we're talking about a PMRF issue.
Yeah, I think most people would start or assume to start with the second part, right? It's
Yeah,
like, if I have postural issues, let me strengthen the muscle.
Let me mention why that might not work good.
Okay.
Because this is actually very important. I'm glad you said that. Because this is more of a traditional approach, right? If you tell if you go traditional physical therapy or something and you mention being tight head to toe and you start pointing out areas on that side that are bothering you, you're probably going to get localized exercises for those areas. Or you're going to get some sort of technique performed on you, some sort of, let's call it manual technique performed on those areas.
Massage, trigger points. Yeah.
Yep. Here is why that. Now, don't get me wrong. It could actually create temporary relief, and I'm not even going to say temporary relief is a bad thing. Temporary relief is temporary relief. Anybody who's ever been in pain would like temporary relief. So it's not like, hey, that's only temporary relief. But if you want to start solving this stuff long time, here's why the approach could fail. So when you look at what we know about, well, let's start with voluntary movement. Remember what I was talking about with the loop. So if I was trying to affect a tight right side, I might do left-sided complex nonlinear movement. That activates the opposite cortex. So if I'm only exercising the tight side, because of that loop, I am now activating the wrong side of the brainstem. Because if we're talking about a right side of the body, head to toe that's tight, and I start exercising the right side to try to deal with that tension, I'm now activating my right cerebellum and my left cortex more so, which is going to fire down into my left PMRF. That's the wrong side. So
the imbalance might increase.
And that is why sometimes when people do a targeted approach to the tight areas, it might feel good to do it, but in the long run, they might start feeling an increase in tension because the imbalance might be getting larger. So it doesn't always get larger. Sometimes it just doesn't work, right? And you're like, well, I feel temporary relief, but nothing sticks, and that might be what's happening if you have a PMRF issue. And it's really the same idea with sensory stuff like manual therapy, because we know that for the most part, this rule is it's close enough. All sensory input goes to the contralateral cortex except smell. So that means if I get a massage on the right side of my body where my muscles are tight, yes, I'm getting localized stimulus to those receptors, but that information eventually gets processed in the opposite cortex. So if I get a massage on my right side of my body, we're activating the left cortex, which then activates the left PMRF. Once again, it's the wrong side. So this is just why the localized approaches often fail for this pattern.
Yeah.
Right? It's for this pattern. So yeah, that's a good thing to know.
Yeah. So to summarize, try complex nonlinear movements on the opposite side. So
yes,
she's got a tight right side of her body. Maybe she's doing windmills with her left arm and knee circles with her left leg, or you've got a plethora of probably better and more varied exercises on. Is YouTube probably the best place to look for that? Or
YouTube's good. YouTube's good. It could be better, but it's good. I've got a ton of exercises over there, but many of them are just demonstrations and not tutorials.
Right.
But if you're resourceful and you don't mind just watching a video and trying to mimic it, I've got so much there, hundreds and hundreds of videos.
Great.
But it just depends on the type of person. Some people get mad at me and they say, there's no audio with this. And I say, it's just a demonstration, because we, for our students that want demonstrations, but other people don't mind it, right? Because they can follow it and figure it out.
Yeah. And then the other thing you would add to that is right side, more traditional, just strengthening of those
muscles. The extensors above T6, flexors below.
Yeah.
That could go a long way. And my students that listen to this are going to be like, there's so much more. There's so much more. And
Yeah.
I'm just going to say, you should explore vision and vestibular exercises.
Yep.
And we can't get into the nuances of that now because we'd have to teach a seminar to teach people all of the pathways involved with an eye movement or a canal movement, meaning a movement of the head.
Yep.
But here's the thing, you actually don't need to know sophisticated neurology for that stuff to help a PMRF issue. And it's very effective in doing so. So again, I've got tutorials on YouTube. It would be worth your time to explore vision and vestibular exercises, even if it's done in a general way, because even doing them in a general way will activate the PMRF as well.
Yeah. And if you're listening and you're like, why the heck would training vision have anything to do with this? We've got an entire episode on that.
Yes.
And then same with the vestibular system. So if you want to do a deep dive on either of those, there's a podcast for that. And that'll be pretty much the theme for everything.
Yeah, we're starting to stack them up. Yeah, we're starting to get a nice layout so people can go and learn about this stuff. Do we have one about the brainstem too? Did we do something about the brainstem? Or was autonomic function?
We did one on autonomic function. So a lot of times we'll come at it from different ways. But yeah, we did one on autonomic function, and then I do think we did the cerebellum.
Yep,
so that's
we did
not
that
quite
as well.
the brainstem, but
right. So that'll describe some of the complex nonlinear aspects to what we discussed, and then the autonomic function one will actually go into the brainstem.
Yeah. So it's all there, and we're coming at it from different directions. But yeah.
Cool. Thank you for the question. It's a good one.
Yeah. Best of luck with that right side tension. This one is from Meadow144K. Boss man, greetings. My question is pelvic left side, wallet sitting years before, and now I see the effects.
Yeah. I'll be honest, out of all the questions we got, this one made me really, I was the most unsure about this one. I could kind of approach it in several different ways. If basically, can sitting on your wallet for an extended amount of time, obviously it's going to impact your alignment, right? One side of your pelvis is going to be essentially hiked. My first question would be, well, how long did you do this for? It sounds like because they're asking, they have a long history that they're wondering about. Yeah, years. He's probably got a big fat wallet too.
I know, old school. I used to do that.
Old school, me too. Me too. I mean, gosh, old school is your wallet's 1.5 inches thick.
Yeah. Yeah.
It's like now we're just carrying around a card, debit card or something.
And I'm not sitting on my phone.
Yeah.
Yep.
Right. Right. I did that too, a bit anyway. Could it impact pelvic alignment and could there be consequences to that down the road? I think there could be. Again, it would have to be like, how much sitting did you do? Was it super chronic? I mean, we know that based on the said principle alone, specific adaptation to imposed demands, we know that the brain and body get better at whatever it is that you do. For better or worse. Your brain and body doesn't care if something is optimal for your health or not. You're just going to get better at what you do. If what you do is you sit a lot, expect to get better at sitting. And that's kind of the scary part about adaptation, So could you essentially adapt posturally to wallet sitting? I think you could. I think you could if it was something that you did for a long period of time and your sitting was never counteracted in ways maybe that were healthy. Maybe you could develop SI issues. Obviously, there's going to be possible upstream, downstream consequences to that through the spine or whatever.
Yeah, I was going to say maybe a minor scoliosis or something.
Yeah, it would have to be. I mean, again, in my mind, this has to be like really chronic.
Can I offer another example and see if that people looking at their phone.
Yeah.
You know that posture with the head
Yes.
down, the
Forward
skull
head
kind of
carriage.
forward, and then you develop kind of like a bump on the back of your neck.
Yep.
I mean, is that due to just holding your head forward, or were people doomed to have that posture?
I think there's more I think there's more factors to consider, but yes, this is the same idea. Sitting in front of a screen that is changing your with sitting and being in front of a screen, the visual system's a big part of it, right? Because you're looking at a screen, so that means your eyes are converged chronically for an extended amount of time and they don't get a break from that. So convergence is when your eyeballs adduct, so they go inward towards the midline to look at whatever it is that you're looking at, your phone, your computer screen, whatever. Adduction neurologically, or I should say convergence neurologically, will kind of encourage more of a flexor based posture.
Yeah, you kind of lean forward when you squint, right?
That's right. Yeah, exactly. And neurologically, it's interesting too, because like the cranial nerves involved in the skill of convergence come from the midbrain. So especially like we're thinking like ocular motor nerve is a big one to consider there. Cranial nerve number 3, which is going to be involved in a convergence. So is cranial nerve 4 if it's a trochlear nerve, if it's kind of like a down and in with the eyeballs, which it often is, right? As you're looking at your phone in your hand or something, that's going to encourage more of a flexor based posture because by design, it makes sense, right? Our body kind of mimics what our eyes are doing.
Right.
Right. And flexor tone, a large amount of our flexor tone actually comes from the top of the brainstem. It's called the midbrain, and that is where those cranial nerves originate, which is interesting.
So back to that brainstem. Yep.
Yeah. So yes, this is kind of a similar idea, I think. I mean, an extended, like if you're practicing a certain position for a long period of time, I think that, yeah, there could be consequences to that eventually, structurally, if you have enough practice with it. So again, I don't know this person's history. We don't have a lot to go off of.
Right.
But yeah, my answer is yeah, it's a possibility. Also realize that, we're not so fragile. Like somebody might, oh no, I wear my wallet. I sit on my wallet. I'm doomed. I mean, we're not so fragile that this would happen in the short term. Like this would have to be pretty long term, pretty chronic.
Yeah, I mean, I have no idea the age of the person asking the question, but for our purposes, why don't we just assume they're 60 plus and they've had a wallet since they were 12?
Yeah.
Then what?
Right. Big fat wallet just causing you to
just full of money.
Yeah. Yep.
So what? Yeah. How might you approach, a postural issue like that?
That started more structurally than anything. Yeah. So first thing I'd probably be doing there is mobilizing the joints involved. So learning how to move the pelvis. We have a whole pelvic tilt series: anterior, posterior pelvic tilts, lateral tilts, circles, very isolated to the SI joints. So it's a very small movement. More re-education of spinal mobility, training the lumbar spine with some of our lumbar circle type drills, thoracics, thoracic glides, forward, backward, side to side circles. I mean, each joint area for the spine, we have a whole series for as far as mobility goes, and the neck. So, a lot of times the pelvis and the neck are very interesting, the way that they sort of, there's a connection there. We might say where
it's almost like a Z, right? Like if one part bends, the other part bends the other way on top.
Yeah. And we can even look at like opposing joints, because the pelvis opposes the cervical spine, which is interesting.
Yeah.
And so moving your neck can help you move your pelvis better. Moving your pelvis can help you move your neck better. Bottom line is, if in fact this wallet sitting had, structurally affected this person, I'm basically doing joint mobility head to toe, but I'm spending a lot of time focusing on the SI joints, the pelvis, the lumbar, thoracic, and cervical spine.
Yeah.
No question. And here's the thing, though, when a change like that has been created structurally, I should say breathing too, rib cage mobility, you might think about it that way, rib cage mobility. So when a change like that structurally has taken place, we do have to possibly consider the visual system. The visual system and our posture very much connected. And yeah, I would be wanting to look at some basic visual skills, convergence, divergence, especially.
So the through line that I'm kind of getting from this is like, if someone's kind of trained their body to hold itself in a certain way, and maybe their head's slightly tilted now or whatever, and so your visual system has responded to being slightly tilted, and your
Right.
vestibular system has responded to being slightly tilted all the time, and that's the baseline for your brain now. Basically, what you're trying to do is promote elasticity, right? To change those patterns back to a healthier alignment, right?
Yeah.
And so everything you're saying is like, well, it's not so much that like we're going to have like an instant kind of neuro reaction that's just going to fix this. It's more like we need to train your body to remember it's okay to hold itself in a straighter line and not default back to this position it's so used to.
Yeah, especially if we're talking about like a long-term structural change that has been developed over time. Because now we are talking about tissue remodeling around the structure.
Yeah.
So sometimes we call that like fascial winding, where your connective tissues have now remodeled themselves to, well, it's all in an attempt to help you. It's just that there's long-term consequences to postural change, with your mechanics and that kind of thing. So, there's joint mobility is a great place to start for all those, areas that we talked about. And I think I probably would also be looking at breathing, rib cage mobility, and possibly some more sustained positions with breathing. So call it stretching, where we're actually trying to, if we're talking neuro here, we don't just say fascial work. We talk about the receptors involved. So C fibers we want to train the C fibers through longer duration type positions, if you want to call it stretching, with breathing. So there's an active component to it, and that can be quite useful, especially throughout the trunk and spine region, pelvis as well. So we have exercises for that we like to use called our opener series, which is just basically you position your body almost in like a lunge, and there's basically like an extension-based posture where you're curving your body backwards to open the front of the body. With breathing, we have different breathing drills that we might stack in there. And then lateral openers, kind of the same idea, almost like a lunge position, bending to the side, possibly adding in some small rotations depending on what you want to do and the person's body. Again, stacked with breathing. Really useful tools. Longer duration holds and kind of using breathing to mobilize different areas around the pelvis and rib cage, which essentially feels like a pleasant stretch, right? Which is something that we're going for when we want to activate C fibers.
So if this person, and again, we don't have much context, right? But if this person was largely sedentary because they're sitting, I'm just going to assume that for the purpose of this question. General strength training, do you think would be helpful in kind of just re-educating the body as well and like getting good movement in?
I think strength training is always a good thing. The only thing with strength training is that one of the biggest threats to anybody's strength training is pelvic torsion. So I don't know what we're really talking about here with this person. Like how asymmetric is their pelvis from this? A pelvic torsion is very threatening for especially bilateral strength training, because your pelvis, the shape of your pelvis can be quite different. And I'm not saying that it should be perfectly symmetrical, because very few
really
people have that. But when the imbalances get too great, especially when we go under loads in sometimes deep positions as well, sometimes there's more threat there with bilateral training. So we might, in that scenario, let's just say, okay, this could be a pretty significant postural thing, pelvic torsion of some kind. More unilateral strength training is generally more received better by the body without any problems.
Awesome. And yeah, I mean, with all of these questions, it's one of the IT guys I worked with once. I think I told you this before. He was like, doing IT remote is kind of like giving a haircut over the phone.
Yeah.
It's just like really hard to know exactly what the person on the other end is doing and what's actually going on. But we're trying to just give you some breadcrumbs to follow,
Definitely.
to find some solutions here. All right, next question. This is from Sarah Giles 93. Any hints for keeping the brain strong from dementia using neurophysio?
Yeah. Well, so I'm not the most qualified person to talk about dementia because I don't study the disease and it's not my job to, right? So I get tons of questions that sort of every day that sort of cross into more of like the medical world. And it's like we talked about before, right? People, when they hear the word neurology, they assume lab coats and doctors.
Mm-hmm.
And in here I am in, a sweatshirt
Doing
talking neurology.
taekwondo kicks. And
Yeah, exactly. Yeah. So it just is what it is. Things are changing fast. Luckily, we have amazing access to this kind of information, but it's just, it hasn't caught up. And so I get a lot of questions that are more medical. And obviously I have to pick and choose, what I can answer or how I might answer. So for me, this one, like I'm not as qualified to talk about dementia because I don't study the disease itself. But my stance is, yes. The answer is yes. Keeping the brain strong. Like, can you keep the brain strong? I am not in a place where I can say, if you do this, you will not get that. Like, there's no possible way I can talk like that. But I can mention some things that come to mind that theoretically make sense. Okay. The first one is cardiovascular exercise. Like nothing fancy necessarily, but just engaging in cardiovascular exercise. And there's probably kind of a laundry list of reasons why that might be a good idea. But the thing that's I'm thinking of the most is circulation, right? I mean, we know that in order to keep a structure healthy, it has to have good blood flow, no matter what structure we're talking about. And when blood flow issues, become a thing, well, then the health of whatever tissue is not receiving as much blood flow as it needs to will go down. So we want to keep your brain healthy and other parts, obviously. Cardiovascular exercise is a good idea. Okay. And on that note, as far as like blood flow, fuel, CO2 tolerance training, if our listeners aren't familiar, that is like a form of breathing work that is quite useful in improving circulation.
Is this air hunger?
Yeah, it's like air stuff.
Air hunger.
Exactly. It's like along the lines of air hunger exercises, which may reduce your breathing pretty significantly so that you feel air hunger as you're doing the exercise. We can even do them completely breathless, where you exhale, hold your breath, and then maybe you're doing some kind of movement. Just nasal breathing with some sort of cardiovascular challenge that is enough of a challenge to bring you to a state of mild air hunger, but not such a challenge that it forces you to mouth breathe. That's like one of the easiest, lowest hanging fruit types of CO2 training that is unbelievably healthy for people. It's just sustain the nasal breathing during the work. And it prevents you from doing like high intensity stuff, right, unless you like really train. Like if you really love this idea of CO2 tolerance training, like there are people who take it, levels and levels and levels up, where they have now actually got to a point where they're effectively training their brain and body not to rely on mouth breathing as soon as maybe it did before. Mm-hmm. That's the tolerance piece. And some people even report like not needing to mouth breathe during pretty strenuous athletic movement, which is quite impressive. That takes a lot of work. You don't necessarily need to do that to get the health benefits of this technique. I always start people with the nasal breathing idea with cardiovascular exercise, whatever your form of cardio might be. That could be a stationary bike. For some people, this might start as walking. It might be hiking, but only nasal breathing, which is probably personally my favorite way to do it, especially if your hike is on just enough of a incline that it's challenging you. Your heart rate is up, you're sweating, you're working, but you're not needing to default to mouth breathing. That's fantastic. So you can use almost any kind of activity as long as you can sustain the nasal breathing. That is so healthy for the brain. It's ridiculous. Yeah. So that was kind of at the top of my thoughts. And then obviously just plain old strength training, right?
Yeah.
You just cannot get around this. I cannot believe how many people do not strength train.
Yeah.
I can't believe it. I also can't believe how many people think they strength train, but actually don't, in terms of what my definition of that might be. Like in terms of like, how much resistance are you working with? I just can't believe it, because we are so sure at this point that strength training and cardiovascular exercise is like basically the healthiest thing you could do.
Yeah.
We're so sure at this point that it has become boring to talk about, but we're also shocked at how many people still don't do it and even don't know about it or something. It's amazing, but just basic strength training, so healthy. Work with enough resistance to challenge yourself. Continue to challenge yourself progressively, safely over time. Man, that will really pay dividends for anybody in their health long term. And then to add kind of a couple of neuro things here, we've got vision training as a big one. Vision training is unbelievably useful for activating a person's cortex. There's a lot of brain areas at the cortical level that are involved with vision. Too many to even name, but like we think about, a lot of times people just sort of think about the occipital lobe as being kind of the home of visual processing, which is a simple way that you can look at that brain area. But the areas involved in vision exercise or visuals, taking in visual stimulus and processing it, is very widespread throughout the cortex. So vision training, and you don't need to know anything special. You just need to know the exercises, right? So I've got a lot of those on the YouTube channel. Pencil push-ups is a great one to start with, where you follow a target in towards your nose and back out. And from there, just basic eye circles, smooth pursuits, tracking a moving target, different shapes, whatever you want to do with that. Again, I've got ideas there on YouTube. Those are great starting points for vision training. It goes way further than that, but just moving your eyes, training those muscles, keeping them healthy, really, really important thing. And then the piece that's worth mentioning that could be added to an exercise routine, especially on this topic of staying strong in terms of hopefully reducing the possibility of dementia, cognitive loads, right? Adding cognitive loads to training, which most people have never, ever done, ever. And that could mean a couple of different things. It could mean that we need more decision making happening in our exercise program. Everything becomes very boring and linear, and you can almost, especially if you're following kind of the same program all the time, you can almost check out mentally as you continue to exercise. And you don't want that, right? You want enough novelty and decision making happening in your training. So we need to bring like more athletic qualities into our training. And that's one way to think about it. So becoming more reactive, like reacting to visual stimulus, not in everything, but spend some time doing it, right? Be more athletic, move around, jump, land, spin, roll, get up, get down off the floor in different ways, respond to external things like maybe hand-eye coordination drills with a ball, learn to juggle, all that fun stuff. We can throw vestibular stimulus in there with all the, jumping rope. Amazing. So those things that have kind of gone missing from traditional fitness are super important. The athletes are still doing this stuff, right? Because it's kind of, they get it, right? They need to move athletically in their training. But as you get out of athletics, it's harder and harder to maintain some sort of athletic activity or athletic movement in your training. So to take it even further, and they do this even in like rehab settings, whether it's post-concussive or even working with dementia, is literally adding cognitive loads in the sense that you're exercising, your heart rate's up, you're doing work, but maybe at the same time you're being asked certain questions, you're being asked to sequence certain numbers, or what do we call it? It's like memory recall. So you're exercising and somebody gives you a sequence of numbers or words or letters or something, and maybe in 5 minutes, you have to repeat the sequence, right? That's a very demanding kind of cognitive load, especially while you're tired. There's so many things there's so many things you could do in regard to like cognitive loads with training, but those are things to think about, right? Especially when we're talking about dementia.
One of the ones that you mentioned in a previous episode, which I liked the idea of, was like you might be doing a drill, and then you might flash like a color, and also on the color is printed a word, and it's not the same color. It's like it might say red, but the color
test
is yellow. The Stroop test. There you go.
Nice, good one.
And so
good
you
one.
have
Glad
to
you thought of
like,
that.
all right, we're gonna do just read the text, not the color, or say the color, not the text. And of course, while you're performing a movement, that becomes that much harder, right? So
yeah, I've done stuff like in my own training. I haven't done this in a while, but I played with the Stroop test for a while because I'm kind of terrible at it. Again, it's that a lot of frontal lobe, a lot of temporal lobe, a lot of inhibition, right? Especially when you're
Don't
tired,
say
right?
The first thing that comes to mind. Be more discriminating. Yeah.
Yes, and what might be easy sitting down at a table doing a Stroop test might actually be really hard when you're in real life doing something strenuous. So like you can swing a kettlebell and at the same time do a Stroop test.
Oof.
So you're being taxed with something that's challenging, assuming you know how to swing the kettlebell and you're safe to do it while you get essentially distracted with a different cognitive load. But you could pick anything. You could jump rope. While doing a Stroop test. But yeah, that kind of cognitive load to the training is very challenging and I think very useful.
It's so interesting that so many questions regarding health come back to the same things. It's like, do your cardio,
all the time,
do your strength training, and then if you're informed about applied neurology, also do your basic vestibular visual training, which is, I think, the part that most people just don't know about.
Yeah, it's true. It does always come back to a lot of the same stuff. With neuro, it's there's always, especially the way that we are approaching it and teaching it, there's always the basic things that should be happening all the time. The joint mobility, the neuromechanic drills, the generalized vision vestibular activations. And then with neuro, it's like the more targeted your goal becomes, the more specialized your goal becomes, then the more specialized the application of neurology becomes.
Yeah. We have an episode on the low-hanging fruit of applied neurology, and so it's just kind of your basics if you want to just start training all these different elements of the nervous system, that might be missing from your traditional exercise program. We've got some good ideas there.
Nice.
And then, the only other thing I wanted to ask about with this particular question is novelty, for novelty's sake. What do you think about learning a new skill or
Absolutely.
learning a new sport?
It's a good thing to bring up.
Yeah.
Novelty is fantastic. Learning something new, fantastic. I mean, there's so much value in that. There's always a debate about novelty, especially in the fitness industry. It actually, there is such thing, I think, as, maybe using too much novelty in your training, because then you don't get the basics done. So there's always that. But if you can strike a nice balance, it's fantastic. Learning new things, being exposed to different ways of moving and learning new skills, whatever they might be. Yeah, huge value.
Awesome. Yeah, that's our first Q&A episode for KRUSE Elite. How'd it go?
How many did we do? 4?
I think just 3.
Just 3? Oh, okay.
1 hour, 3 questions.
Wow, just like you said would happen.
You see these questions and it's like one sentence and you're like, oh man, we're just going to blow through these.
I know. That's exactly what I thought was going to happen.
Yeah. Turns out we're nerds.
Yeah. Well, that's good. I'm glad we started this. I am hopeful that the listeners will enjoy this and want to keep going with it. And I do. I think it could be a nice addition to the lineup of episodes.
Yeah. So do look out if you have questions of your own that you would like answered on the podcast. Taylor will be posting about it in the future again. And we really appreciate all the questions that came in. We've got more that we haven't gotten to. So definitely look forward to more episodes as well.
Yeah. Thank you, everybody. I will, keep your eyes peeled. Like on Instagram, I think is a really easy place for me to put up the question box, and with the posts that we put out there, sometimes we'll ask people what questions they have in the post, but not everybody sees the posts, right? So hopefully, I think most of the folks who are really highly interested in what we're teaching are usually looking at the Instagram stories. So that's a good place to see it as well. All right. Well, thank you again, everybody. If you get a moment, we would be really grateful if you could give us a review on the podcast. We're really trying to just improve this and get it out there, and all those little things that you do that kind of help out the algorithm. Well, that goes a really, really long way. And it is really the only way that we can really get the podcast out there and find more listeners like you guys. So if you would be so kind to give us a review on one of the platforms, whichever one your favorite one is where you listen, that would be an amazing help for us.
Thank you so much.
All right, guys, I hope you enjoyed this, and we will be back soon.